Good evening, guys. I have discussion D for you. We're discussing finding treatment solutions with holistic health. Okay? This falls under healthy aging for me, so this has to do with aging population too. Okay, so here we go. Here's a summary of the main points from the article Finding Treatments Solutions with Holistic Health. Takeaways on holistic health. Whole body focus. Holistic health emphasizes treating the entire body rather than just isolated symptoms. Dr. Eric Snow explains that understanding how body systems interact is central to this approach. Gut health as a foundation. Digestive health plays a crucial role in overall well being. Issues like chronic pain, autoimmune disease, and fatigue can stem from poor gut function and or dietary sensitivities. Food as a trigger. Certain foods can cause inflammatory or allergic like responses, leading to symptoms such as brain fog, joint pain, and autoimmune flares. Identifying and eliminating these triggers is key. Alternative medicine redefined. Holistic practices are increasingly seen as essential rather than alternative, especially when conventional medicine falls short. Insurance coverage. Some holistic or functional treatments may be covered by insurance depending on the plan and treatment type. Would you like to explore how these principles could be adapted for culturally responsive care models or integrated into community-based interventions? Holistic health can be meaningfully applied in your life by aligning its principles with your values and daily routines. Here's how you might integrate it. Personalized applications of holistic health. Whole body systems thinking, your sweet spot. Use your systems lens to assess how physical, emotional, and social factors interact. Apply interdisciplinary care models that consider mental health, nutrition, mobility, and cultural context together. Gut health as a diagnostic and intervention tool. Explore gut brain connections in your work with aging and cognitive health. Use dietary assessments and culturally adapted elimination protocols to identify triggers in underserved populations. Food as medicine. Promote food literacy and culturally responsive nutrition education. Co-design community-based interventions that address food sensitivities and inflammation, especially in frailty-aware care. Reframing alternative as essential. Advocate for integrative care models in policy and practice. Petition holistic strategies as complements to conventional medicine, especially where standard treatments fall short. Insurance and access. Investigate coverage pathways for functional treatments in Medicaid, Medicare populations. Develop toolkits to help caregivers and patients navigate holistic care options within their plans. Would you like to co-create a framework that blends holistic health with participatory design for seniors' well-being or caregiver support? Mind and body interventions are holistic practices that recognize the deep connection between mental and physical health. They're especially powerful in aging populations. Caregiver support and culturally responsive care. Here's a deeper look. What are mind and body interventions? These are techniques that engage both psychological and physiological systems to promote healing, resilience, and well-being. They often include meditation, mindfulness, reduce stress, improve focus, and support emotional regulation. Yoga and Tai Chi enhance mobility, balance, and strength while calming the nervous system. Breathwork and guided imagery activate the parasympathetic nervous system to reduce anxiety and pain. Expressive arts, music, dance, storytelling foster emotional expression and social connection, especially in dementia care. How you might apply them. Domain applications, senior engagement, integrate chair yoga or Tai Chi into digital outreach platforms for mobility and fall prevention. Caregiver support, offer guided meditation or breathwork models to reduce burnout and improve sleep. Culturally distinct communities, co-design storytelling or music therapy programs that reflect cultural narratives and traditions. Okay. Frailty aware models use gentle movement and visualization to support pain management and emotional well being. These interventions are low cost, scalable, and adaptable across diverse settings. Would you like to co create a culturally responsive mind and body toolkit for caregivers or older adults? Here are specific examples: mind and body interventions that you can adapt for aging populations, caregiver support, and culturally distinct communities. Specific mind and body practices, intervention, description, example use. Tai Chi, gentle seated movements to improve flexibility and circulation, offered via digital outreach for seniors with limited mobility. Okay. Guided meditation, audio or video sessions that promote relaxation and mental clarity, including caregiver support toolkits to reduce stress and burnout. Tai Chi for balance, slow flowing movements that enhance coordination and prevent falls, integrated into community wellness programs for older adults. Breathwork exercises, techniques like box breathing or diaphragmatic breathing to calm the nervous system, used in frailty aware care to manage anxiety and pain. Storytelling circles, facilitated sessions where participants share personal or cultural stories applied in dementia care to foster connections and memory recall. Okay, folks. Um, Music therapy, listening, singing, or playing music to stimulate emotion and cognition, co designed with cultural input for senior engagement platforms. Would you like to co develop a module toolkit that includes these practices tailored to different cultural and cognitive profiles? Here are some excellent resources and platforms you can use to implement mind body interventions in your work with aging populations, caregivers, and culturally distinct communities. Implementation resources for mind and body practices. Practice resource use case. Okay, Tai Chi or chair yoga, yoga for seniors. Silver Sneakers offers free video classes. Tailored to older adults, ideal for digital outreach, guided meditation, insight timer free app with thousands of meditations, including caregiver stress relief, Tai Chi for balance, Tai Chi for health, institute evidence based programs for fall prevention and chronic conditions, breath work exercises, the Shift Network Breathwork Summit offers culturally inclusive breathwork training and resources. Storytelling circles, Tai time script, creative storytelling for dementia care, and integrational engagements, music therapy, music and memory, personalized music programs for cognitive and emotional support in seniors. These platforms offer free or low cost tools, many of which are adaptable for community mapping, caregiver toolkits, and culturally responsive outreach. Would you like help creating a resource guide for implementation plan tailored to your current projects? Okay, guys, so that is it for tonight. I will be back on tomorrow for shows. Until then, get our wellness. Take care, folks. Have a good evening.